everybody, welcome. My name is Brandy Alden, and I am here interviewing today with Board Certified Chiropractic Neurologist Dr. Lauren Brindisi of the Carolina Functional Neurology Center about chronic conditions and the benefits of functional medicine. Dr. Brindisi started her studies at the University of Albany, where she studied neuroscience and volunteered as an emergency technician and trainer. She continued her graduate studies through Carrick Institute in Lake University, and even had the privilege of learning directly from Professor Carrick. She is a diplomate of the American Board of Chiropractic Neurology, and now treats a variety of complex neurological cases from across the country. If you're ready, we'll go ahead and just jump into the questions. How's that sound?
Let's go ahead.
Okay. In America, the primary source of healthcare is what we know as Western medicine. As a functional medicine doctor, can you explain the differences between functional medicine and Western medicine, and what are some of the benefits of each?
Yes. So when we look at traditional medicine, a lot of the history is looking at diagnostics, what we do to diagnose someone with a specific condition. I always tell patients it's a little bit more black and white. Do you fit in this diagnostic box or not? And do we have a more systematized treatment plan, usually as a course of medication or surgery that can be helpful for these conditions? Functional medicine really comes into play with a variety of chronic conditions because we look at things a little bit differently. For example, with lab work, what we do is we take the traditional lab ranges and we tighten up those parameters. We want to look at what optimal ranges are, and we want to understand what each patient's physiology actually is, and try to get down to the root cause of why someone may be experiencing a certain condition, not just say they have a diagnosis and give them the medication, but what we can do can also be very complementary to that in terms of how do we look a little bit deeper and not treat someone so much for the condition that they have, but how do we work to actually optimize their physiology.
That's fantastic. I know I've grown an appreciation for functional medicine because you look so deeply into things. And for somebody like myself with chronic conditions and not really ever finding a definite answer for anything, when I came to your center, being able to take that deeper look into everything was very helpful for us to, like you said, find that optimum level. What is my optimum level for me and somebody of my size and somebody like myself?
Yeah, yep, exactly.
All right, well, what kind of treatments do you offer as a functional medicine doctor in your center?
Yes, so specifically I am a functional neurologist, so most of my postdoctoral training is in clinical neuroscience, and we do a variety of things in our office, as you know. So most patients, they come in for the initial exam. It's pretty lengthy, it's about an hour and a half, and we run several diagnostics here in our office that actually look and evaluate the function of somebody's brain. So most of the patients that come into my facility have some type of neurological condition, really across the spectrum. We see young kiddos not meeting milestones, all the way up to elderly patients who have neurodegenerative conditions. And again, as a functional provider, we want to look a little bit deeper at the integrity of their nervous system and how that compares to normative data. So that's the first step. We do a comprehensive exam when the patients are in the office. We're trying to evaluate all aspects of their nervous system and really triangulate where some of that dysfunction may be coming from. And then we devise a treatment plan that centers around neurological rehab methods to actually activate and exercise somebody's brain to help it heal and repair. Now, there's a whole other side to that in terms of more of the metabolic side where we run lab work. Just like I mentioned before, we might evaluate what's going on with their gut. I have all these specialty labs that we may run. If there's some neuroimmune issues going on, we may run autoimmunity panels. So there's a wide variety, food sensitivity panels. It's very individualized really for each patient. And then the treatment plan just varies heavily per person in terms of what they actually need. We have a ton of tools here in our office. We have hyperbaric oxygen therapy here. We do tilt table therapy for our dysautonomia patients. So we actually help them in terms of what's going on with their heart rate when they're changing position, and how we can reintegrate that information so their brain's telling their heart what to do a little bit better. We do eye movement therapies, vestibular rehabilitation. We have different somatosensory devices, one called neuromodulation. It's just, I got a whole bunch of tools in my tool bag, and it's really about exercising the nervous system and creating what's called neuroplasticity, where we want to use the idea of neuroplasticity and the brain's ability to change and heal and adapt based on the our environment. We want to do that to the patient's benefit, where we can actually create lasting change in the nervous system. The analogy that I always use is just like people go to the gym, right? You work out your muscles and they get bigger and stronger and more defined. We can actually do that for the central nervous system.
And that's so cool. I think that's amazing that you can almost retrain the brain in a lot of ways to help break the patterns. Like, I guess, with a dysautonomia patient, when your brain isn't necessarily communicating with the rest of your body about how to regulate things like heart rate, and using that tilt table, what did you call it again?
Tilt table therapy?
Tilt table therapy, yes. To be able to retrain the brain to communicate and regulate those things on a normal basis, which is incredible if you think about it.
Yeah, it really is. And it's so interesting because most people are so conditioned to think that we need medication or we need surgery to help a condition. That's just what we're accustomed to, especially in America, and most of us are used to traditional medicine, is that you can make very profound changes in somebody's nervous system by exercising it. Mm-hmm. And a lot of the rehab methods that we use are not super complex. I mean, we do varying eye movement therapies, like I said. We've got people just staring at a dot and turning their head, and this can make huge changes for people, and lasting changes in their brain function, so they can get a better quality of life.
Yeah, I know the eye exercises are things that I've had experience with, and I can say from experience too that it's something I do every single day now, and it takes like 5 minutes, but I notice the difference. I notice, especially even with my vision, if I don't do the exercises, my vision won't be quite as sharp, but since starting these eye movement exercises, being able to see things clearer has been one of the many benefits I have seen. And so it really does showcase the power of what you can do. And considering that the brain is involved with everything in the body and communicates with everything in the body, I love that you have such a detailed focus on it at your center. All right, well, we talked about this just a little bit now, but in your clinic you treat a variety of neurological and metabolic conditions such as dysautonomia, POTS, migraines, thyroid disorders, traumatic brain injuries, and neurodevelopmental disorders such as autism and ADHD, just to name a few. What are some of the common misconceptions you see associated with conditions like this?
That's a great question. I think the toughest thing that comes along with most of the patients in my office is that everybody is dealing with what's called an invisible injury. So when there's dysfunction in the central nervous system, most of the time for these patients, you can't tell from the outside. Walking around looking completely normal, and a lot of patients are suffering pretty significantly with a variety of symptoms, whether that be mental, whether that be learning disabilities, behavioral issues, dizziness, headaches. I mean, the list just goes on. And I think that's the toughest part for patients, really, is that a lot of people, and I hear this too often, is that people don't understand. They don't understand that they're struggling, and most people say, but you look fine. Mm-hmm. And you're like, well, I don't feel fine. Right? You're having a lot of trouble, and I think that's really tough on people. And I think that's a common misconception that I'm pretty passionate about trying to debunk, because you just don't know what somebody's going through, and you can't always see it.
Absolutely, especially because a lot of the symptoms that you just mentioned are things that nobody can really see. Unless somebody passes out in front of you, you're not going to know that they're feeling dizzy unless they say it out loud. Or if somebody's in chronic pain, you're not going to know that they're in pain unless they express that to you. And so I think it is true that a lot of people oftentimes don't understand that side of it. And so And I think it is really important to have that extra level of compassion for people who do go through invisible disabilities, because you truly never know what kind of day that they're going to have.
Exactly, and that's kind of what I was just going to say is every day is a little bit different sometimes, and especially when people are on a healing journey, they could feel great one day and that could get turned on its head in a moment just by something simple that most people take for granted, like standing up, doing the laundry. You know, there's little things, just getting in the car can just completely derail somebody's day one day, and it might be a little easy for them to do the next day. So if you do know somebody who deals with a chronic condition that you can't see, I think that that's really important for people to understand, that just checking in on them. How are you doing? How are things going today? And like you said, just showing compassion.
Absolutely. I think that's great advice too. I know my family, I'm very lucky to have a family who checks in with me quite a lot, but it can be very difficult for those family members who don't understand to try to explain those things to them. So I love that you pointed that out. Okay, how would you explain the concept of neuroplasticity, like we talked about before, to somebody who has never heard of it? And how do you implement that into your practice, which I know we talked about a little bit, but can you go into a bit more detail for me?
Yeah, I'll expand on that. So neuroplasticity is a term that really more recently in neuroscience has been widely accepted as fact, that our brain has a constant ability to change and adapt to our environment. Now, we used to think that when you were born, you had all the neurons you were going to have and all the connectivity you were going to have, and it was just, that was it, or downhill from there. But now we understand that neuroplasticity can happen throughout your entire life. It is happening. And that can happen for good reasons or for not so good reasons, which is interesting because that's how people can be symptomatic. That's how people end up with addictions, poor habits. It can work both ways for you. So our brain really, and this is what I say to patients a lot, is just a bunch of habits. So the more you fire one pathway, the more ingrained it's going to get. Just like if you go and just work out your left bicep every day, right? Your left bicep's going to be bigger and stronger, more defined, more fibers than the other one. And that's the same for our brain. It's just the circuitry, the more you fire it, the more hardwired it gets to be that way. So we can use that to our benefit, and that's really when we talk about these neuro rehab methods that we do in our practice, is we're trying to specifically target areas of the brain that that patient may need exercising a little bit more. It's kind of like if there's a traffic jam on the highway and right, the pathway's still there, but it's not flowing as fast as it could because we're down to one lane. That's a lot of the patients that we see. They have functional issues in their nervous system where all the parts are there, they're working well, but there's congestion in a sense. And there's a variety of reasons that can happen, and that can alter the neuroplasticity of the nervous system and make people symptomatic. So what we want to do is try to unwind that, kind of reprogram it, and make that more stable.
Interesting. I love that analogy, by the way. That's really, I love that. That makes so much sense. Okay. I think it's always important for someone to look for the cause of what's going on, because how do you know how to treat somebody if you don't know that underlying cause, you know? For example, I know the experience I've had with you treating me, we found that a lot of my symptoms that I had, such as my neurological symptoms, my fatigue symptoms, and my gastro symptoms, were due to underlying causes such as food allergies and an underlying infection of Lyme disease. What are some of the common underlying causes you see for patients who come in with symptoms that seem to come out of the blue?
Yeah, that's a great question. And I think the reality is they don't usually just come out of the blue. And as we start looking a little deeper into patients' history, that's where we start to see some things that may be playing a role. Some of the big things are definitely head injuries. History of head injuries. We used to think that you had to lose consciousness to get a head injury. Now we understand that you don't even have to hit your head to get a head injury.
Interesting. Can you elaborate on that?
Yeah, you can have just a whiplash injury.
Oh, interesting.
Some patients, if they've already had concussions and they're more susceptible to jolts of their head, they can step off a curb wrong and the reverberation from their feet can affect their brain. That's not as likely in someone who's never had a concussion, but now we have people, getting rear-ended, having whiplash. That force enough with the neck can cause the brain to move around in the skull, and that's really where the concussion comes in. So those are definitely big ones that I see a lot of. Patients who have underlying infections that may not know that they have underlying infections, or they do know that they maybe had a severe illness such as COVID, the flu, exposure to toxic mold. Those are other big ones. And patients that have underlying autoimmunity. So we've got some dysregulation in the category of the immune system that can certainly affect the nervous system. And then the other big players are the endocrine system. So we have people who have varying reasons that they might have dysfunction in their endocrine system that again can alter what's going on with their nervous system. Some other big ones, surgeries. People go under surgery. I put that in more of a category of trauma.
That makes sense.
It is trauma. So just like head injuries are a form of trauma, we do see people develop issues neurologically after surgery. And then in some cases, more rare, but people can have bad reactions to things like medications that can affect them too.
That makes a lot of sense. I never knew that about head injuries. I've heard before that your brain has the consistency of like soft butter. And so, when you think about all the things that we do that can damage our brain, it really does put into perspective how oftentimes we aren't conscientious of the things that can affect our brains in that way. And then on top of the effect that those head injuries can have on our health and our mental health looking forward in the future.
Definitely.
Okay. So, speaking of COVID, I have been hearing research suggesting that COVID is becoming a cause for autoimmune conditions such as POTS or dysautonomia. Is that something that you've witnessed in your practice, these sort of post-COVID effects? And if so, is there anything that you've found to be effective for these patients?
Yeah, so I've definitely seen that. Not new to COVID, that infections can ignite more of a neuroinflammatory process in the nervous system, and often is causing autonomic conditions for patients. We're seeing it on a really big scale now because COVID is affecting everybody. And a lot of those patients who are developing that do often have a history of other things. There's not a ton of people that I've seen that it just comes out of nowhere. They may have a family history, and it's not necessarily autoimmune. Now, there are some theories that talk about some cases of POTS being autoimmune and actually autoimmune to the vasculature, but there isn't really a definitive on that quite yet, and there is not a good study for it. Like, we can't run a lab test and confirm, but a lot of patients do end up with positive other markers that we may suspect there's autoimmunity going on somewhere.
Okay.
And that may be a case. Some patients, honestly, that I've seen post-COVID and other infections that may cause neurological conditions such as POTS or other types of dysautonomia, they almost look very similar to a patient who's had a head injury.
Oh, interesting.
Yeah, so the way I explain it is it's kind of like an infectious brain injury instead of a traumatic brain injury.
That makes sense.
And that, you get this inflammatory response of the nervous system, just like somebody would if they hit their head. And now it affects a whole bunch of things, and people come in with a bunch of random symptoms that they never had before.
So, to kind of reiterate, it's almost, in theory, it's almost as if this COVID is bringing out potential autoimmune conditions maybe that somebody had underlying, and it's pulling those things out or exacerbating those conditions? Is
Possibly.
that somewhat what we're kind of looking at now?
Yeah, it's all still new, but that's what I see clinically, is that it's maybe there were other things brewing before. Maybe they do have a family history of autoimmune issues, if we're talking about that specifically. Sometimes I see patients did have other underlying chronic infections, and COVID is reactivating them, like Epstein-Barr virus, Lyme disease. Those are probably big ones because those are both encapsulated viruses, so they like to hide They're still there, they're around, but when we get exposed to varying stressors, that might reactivate those things in people. So then you've got a bunch of viruses affecting the nervous system, and people then become pretty symptomatic there. So it's complicated and it's different for everyone. Some of the patients I have who have had trouble with COVID have history of head injuries, so their nervous system already was vulnerable. So it's complicated, and that's again where functional medicine really comes in, is that we're gonna look a little deeper at what else was going on. How do we really individualize the treatment plan for that patient's needs? Even though two people may come in with the same diagnosis, the underlying issues may not be the same.
And then therefore the treatment would not be the same, even if somebody comes in with the same condition, correct?
Exactly. Yeah, treatment is not condition specific.
I love that. I love that you made that point too. I think a lot of times people think that they have, one choice when it comes to treatment, kind of like we talked about before. Oftentimes, I've been told, that my only kind of treatment that's available to me is medication, and being able to look into treatments beyond that when that didn't work for me has been really beneficial. And so I think that's important for people to know, is that if you're struggling with something, just because one treatment works for one person doesn't mean that's going to work for you, and that it's important to navigate different treatments to try to figure out which one is the best fit for you and your body and your history. Okay. As a neurologist, I know you understand the importance of brain health when treating mental and physical illnesses. What are some brain healthy habits that you believe we could all work on in our own lives?
Yeah, there's several. That studying neuroscience is something I'm very passionate about, and it's really changed the way that I live my life on a regular basis. And there's some very specific things that kind of are getting back to basics, things people have heard, but when you think about it in the context of your nervous system, I think it bears a little bit more weight. So big is sleep regulation. So there's a lot of things in our modern day right now with technology that is affecting and altering our circadian rhythms or our sleep-wake cycles. One of them, bright lights, the blue lights emitted from the phones, from screens, from televisions. That blue light is very activating to the brain. And as a lot of people have noticed on your phone now, you have the ability to turn that night mode on. That makes the screen go almost orange, and you can set it so it does that and coincides with the sun. So our bodies work and coincide with the sun. So when the sun comes up, we should have cortisol release, which is just a hormone that tells us it's time to wake up. And then as the sun goes down, we have melatonin, which most people have heard of, should make us feel sleepy. And these lights are changing that. So we have a lot of people walking around with insomnia now because we're altering that sleep-wake cycle, and people are scrolling on their phones at 10 o'clock at night, and your brain's going to think that it's daytime. So being very adamant about the light exposure that you have, and making sure you're getting exposed to sunlight in the morning when you wake up. So don't use blackout curtains, but making sure that it's pretty dark in your room when you do go to bed. And then making sure you're not on technology a couple hours before you go to sleep. And for some people, I'll recommend they start turning down the lights as the night goes on to coincide with what's going on outside. And you can get so specific with that. I mean, now there's these different light bulbs that hook up to your phone, and technology can really work to our benefit in a lot of cool ways. You just have to get a little creative with it.
Yeah, I actually had a friend who he had light bulbs set in his living room where slowly they would start changing to replicate the sunset. And so that would help him with his sleep. I just thought that was so interesting. I actually didn't know that there was even a setting on your phone for night mode, because I think, one, it's normalized right now nowadays to, right before you go to bed, I'm going to look at my phone, I'm going to scroll through Facebook or Instagram, and to know that that's an option that can help if you need to be on your phone. Ultimately, I think it's, like you said, it's best if we could avoid. But for those who do need to be on their phone for whatever reason before going to bed, I did not know that that was an option. So looking into apps, looking into different light bulbs can be helpful. outside of sleep, is there anything else? I know we talked about, concussions too. Is there anything that we can do to be more conscientious of how we're planning activities, I guess, in our lives to not affect the health of our brain in that way?
That's a tricky one because sometimes you just never know. A lot of the people that I see have had head injuries, if they're not athletes, it's a random accident. Obviously in the car, we've got a lot of distracted drivers these days. Do not be one of them, right? You want to be paying attention when you're on the road. A lot of accidents right now are due to people not paying attention. And that's really scary because if you're the one not paying attention, you might not be the one that gets hurt, right? It might be the person that you rear end. And that's tough because that can spiral. You never know, and it can spiral somebody. So paying attention is really important. I think understanding your agility and level, like your activity level, and definitely not doing something that you're not equipped to handle. There's varying versions of physical activity, and some people do a lot of extreme sports and things like that. You don't want to jump into something like that if you're not quite there. But physical activity is very, very important for the overall health of your brain. So being active every day in some capacity is important, but doing something that is within your means too, right? A lot of people want to jump from not working out to working out every single day and lifting heavy weights and things that you're not ready for. And that is going to increase your risk for injury. For females specifically, a lot of females are way more susceptible to head injuries because the stability of our neck is not the same as our male counterparts. So most of my athletes that I see who are females are the highest risk are female soccer players. And so that's something to think about as a female, when we are exercising, like what can we do to create better stability in our neck muscles? Because when you have a head injury, there usually is some type of whiplash, and it's the force of that causes the brain to move around in the skull. So having good stability in your neck and just strength in your body overall is important.
Interesting. Well, I know I've heard a lot about circulation too, especially like you said, getting that circulation to your brain through some sort of physical activity, but taking baby steps to know your limits and know what's there for you. I heard somebody say before that getting out of bed and jogging, first thing in the morning was a beneficial thing for them. And I know for me, that translated into let me start my mornings with yoga to get that circulation going.
Yes.
To try to get everything flowing in your brain to help yourself feel awake, and then also just to set your day out on a good tone.
Yeah, I think I suggest that for a lot of my patients. And again, some of the things I do may be very specific for each person, but when we're talking generally for someone who overall just wants to live their best life, exercising in the morning is going to be better because that's going to wake you up, that's going to improve blood flow, that's going to help cortisol production, which is you want to be most awake when you wake up. And then you want that to taper down as the day goes on so you get a good night's sleep.
Interesting. Okay. So I want to switch gears here real quick and discuss a little bit more about mental health. During my health journey, I found out that much of my mental health struggles were due to underlying illnesses elsewhere. Common causes I've heard about that I don't think are talked about quite enough are things like vitamin deficiencies, thyroid disorders, food intolerances, traumatic head injuries, mold exposure, and infections like Lyme disease, strep, things like that. What are some of the most common underlying causes you see for patients who come in with mental illnesses in your practice?
I see a lot of patients come in with varying degrees of mental illnesses. And while I am by no means a psychologist or a psychiatrist, as a clinical neuroscientist, someone who studies the connectivity of the brain, we understand that this idea of duality, that you have your nervous system and then you basically have your mind, that they're really not two different things. So the function of your nervous system and how we can measure that objectively gives us a ton of information, and that can show up as what we think of as neurological symptoms, right? Someone might have numbness and tingling, dizziness, headaches, other types of pain, vertigo, the list kind of goes on there. That also can be something mental, what we call mental, so affecting somebody's behavior. And I don't think there's really a one size fits all for that. I think that a lot of people develop those, just like we're talking about with a patient who may come in with a dysautonomia, is that you really need to look more individually at what's going on with their overall physiology. And that can be a lot of things. I think you actually nailed it on the head. Some of those that you already discussed, thyroid issues, gut issues. We now understand that the microbiome of our gut has the ability to affect our mood and affect our mental well-being, actually our behaviors themselves.
I've heard somebody say that our gut is almost our second brain because that connection goes both ways.
Yes, it definitely does, and it is very strong, and I think there's a lot that we still don't know and understand. But that's something we didn't really talk about, but what we eat every day is one of the most important things. And you want to be eating healthy, whole foods. I'm eating candy and junk all the time. That can affect your mood. I mean, people with blood sugar issues can have, mental health struggles. So I think a lot of people who do have some of those diagnoses, there's more to look into, just like we look at these other patients.
That makes a lot of sense. Okay, well, if there's someone out there listening right now and who is struggling to find answers or effective treatments for whatever they're going through, where would you suggest that they start? Now, that's a broad question, so I'm sure that's a little difficult, but would you have any advice for these people?
Yeah. If you're interested in just the realm of functional medicine, or we've talked a lot about neurology, honestly, my sister and I, who she runs the business with me, we put a ton of information out there online. I think the education piece is very important, and we want people to be aware of the importance of understanding their brain health and how that affects the rest of your life and the things that you do. So we just put a lot of educational information out there. We have a lot of educational information on our website, blogs, and there's a lot of other people out there. Social media can be such a beautiful thing, and if you're looking for something specific that you want to learn more about, there's probably someone out there who's running a really well-oiled machine of, an Instagram page that can provide you a lot of information, which is really fun to see. People are putting that information out there. It depends on what people are looking for, too. Mm-hmm. So there are tons of books, and I have a whole list of them that I will not specifically name right now, but if anyone is interested, you can always reach out to me for sure, and I'm happy to provide them. There's a lot of good books out there about health and well-being, about, there's podcasts, there's different audiobooks. I know we've talked about some audiobooks, more specifically about mindfulness. One of my favorites is The Book of Joy. I think that's such a beautiful book that everybody should read, and it just really helps you in terms of being aware, being present in your environment. There's tons of books out there about the nervous system and health too.
Well, if you do have any recommendations that you can send to me too, I can also link that below in this video so that maybe people can go and check that out as well. Because I know a lot of the books that you have in your office are ones that I've gone home and I've bought for myself, and I've read them and have been very fascinating. So
yeah, I think that'd be the most helpful. We'll do that so everyone has the list instead of me just rambling them off.
Yeah, so you have some great recommendations. I know some of my favorite books I found from your office, so
I'm glad.
A lot of great resources there, and I will definitely be linking your Instagram page as well, because I know I've found a lot of information there that you posted that I've been like, wow, I never knew that. Mm-hmm. And it can affect the way that you go about your day, and those little lifestyle habits really do make a big difference when you start to put them all together and really put them into your life every single day.
Okay.
Is there anything else that you would like to say before we wrap up this interview to those who may be struggling out there to hold on to hope that they will find something that will help them feel better in the long run?
Yeah, I think, well, one, I want to thank Brandy for having me on here. You are just such an inspiration, and I think that that's a big testament for people who are out there that may be struggling, who do need help. You're a real living proof to just keep fighting and keep working hard to get your health where you want it to be, and that there really is hope. I mean, some people, a lot of patients that I see get to a point where they've been to so many doctors, and by the time they get to me, they're like, we don't know what else to do, right? This is our last leg because we're not quite sure where to go next. And if you haven't found that doctor that has helped you yet, don't give up. Somebody's out there, and there's a lot of new information coming out, and if you haven't explored the world of functional healthcare, functional medicine, that is a very expansive and growing field, and there's somebody out there that will help you.
That's fantastic. Thank you. And thank you so much for what you said. You're a huge inspiration too. I know your journey has inspired much of what you've done with your center, and so being able to see somebody apply that to their future is inspiring to me as well. I want to thank you so much for taking the time to be here today. And if you would like to learn more about Dr. Brindisi and her practice, you can visit her website at carolinafnc.com. And for more health-related content like this, you can find my Instagram at finding.your.internal.symphony. Thank you so much for tuning in, and I hope you have learned something today.